Thank you, Georgina, and a huge thank you for inviting me along to speak on the webinar. Really fortunate to have two of our patients here with us, Mr. and Mrs. Easton, who are going to talk later about their experiences. So a huge thank you for coming along. So we started our journey at Woodley Centre Surgery about 2 years ago now, where we did face-to-face group consultations. And those face-to-face group consultations were in things like diabetes, pre-diabetes, chronic pain, paediatric asthma. And what we found was it was immensely satisfying for the clinicians. We felt reinvigorated doing our roles and have a really strong admin support team around us to help us plan and facilitate the webinars. We also noticed that our patients formed a network. They were able to talk in a different way to what we normally do in one-to-one consultations. It was definitely more a personalised care approach, a more holistic approach. And we had the advantage as well of utilising the multidisciplinary team. So we could use our pharmacy support, nursing support, healthcare assistants, and then the new breed of ARRS workforce, like our health coaches, social prescribing link workers, and organise with our voluntary sectors, mental health teams. So it's a really good way of engaging the population by using all the skills that we have available to us. So our journey with webinars, we started our first one in April, where we did a public webinar, which was advertised by the local authority, council, all on the Facebook groups, where we really wanted to tell people what COVID was and what symptoms to look out for and when to call for help and what was available in the community for them. And at that time, we also linked in with our social prescribing link workers about the food delivery and the prescription delivery and befriending services and so on. And then we carried on. It was hugely popular, and we had such excellent feedback that we continued doing other webinars, things that we thought would be relevant during lockdown. We had brainstorms with our team, what would be useful, and it's very much the why. Why are we putting this on? What benefit is it going to make? And how do we evaluate it as well? So we looked at healthy eating, and we looked at minor illness for the under fives, which was fantastic because we wanted to empower patients to be able to self-care as much as possible and then call us if needed. And the menopause was immensely popular as well. And we had a huge turnout for hypertension. We wanted patients to know that we were still here despite lockdown, and that we could help them to self-care, and that they understood that empowerment of when to call us and when not to call us. The ones recently were on physical activity, working from home, posture, back pain, when to incorporate exercises into your day. And we'll be doing one for the older population, the over 65s as well, on deconditioning, because we want to prevent falls in this cohort. Next slide, please. So what we're doing at the moment is looking at the COVID vaccination webinars. So far, we've been into a nursing home to vaccinate, but obviously there was a lot of anxiety about that because the nursing home had an outbreak of COVID. More than 50% of the nursing home was affected with the residents and the staff, so it's 60 patients affected, with sadly some deaths as well. And we did a webinar explaining about the COVID vaccine, encouraging uptake, and we managed to get 100% uptake in that nursing home following that webinar. And it was specifically for next of kin. If families had any questions, they could log in from wherever they were in the country. We did another one for our patients, which we had 81 participants in that. The way that we did that was really to brainstorm all the questions that we could think of that patients were asking over to reception or to the clinicians. Lots of anxiety about, the delayed 12th dose, what the differences were between Pfizer and AstraZeneca. People were talking about it being pushed through too quickly. So we talked about the trials and how there was an overlap between the phases to try and get this out, but it was still safe. and talking about the side effects as well, what to expect, when to ask for help if your shivers and temperatures don't go down quickly. And we did find that immensely helpful, because when it came to coming to the surgery, patients knew about the infection control procedures we had in place. And we had lots and lots of photographs as well, showing the flow from when a patient first enters the building, they get temperature checked, and what's on the consent form, what questions will they be asked, and who will be doing the vaccinating, and where they'll sit. So it was immensely helpful for patients, I've been told. So we had some really good feedback from our patients as well. And it's the opportunity for relatives to log in if they want to as well. We also have 2 other webinars. So I also did a COVID Community Champions event on Monday, which involved the voluntary sector organisations and the council, and it was talking to the champions of what they need to know to spread the word about COVID vaccines. And next week I'll be doing another one with faith leaders from Reading and Wokingham in Berkshire. So again, we'll be brainstorming what are the myths, what do we need to get across, how do we keep patients and the community informed with information, no judgment, but giving them the facts so that they can then make an informed decision and dispelling any myths that they might have. And then we've got another one, as in some of our nursing homes in our community have only had a 50% uptake in the nursing home workers. So we want to look at why that is, and do a working and wide webinar for joint with our social care colleagues to look at the reasons for this and really be there to answer any questions. I think it's important to maybe just talk for about 50% of the time and then leave the rest. Really good to have a nice, encouraging, polite, informal style, making it a safe space to ask any questions that people have, and making it into a conversation as well. I think that works really well, where you bring people in, you get to ask their opinions. And what was talked about that Anna said at the beginning was it's really making sure that you have a very safe space. So explain to patients that they will be valued, but also to respect what other people's opinions are, because as we know, vaccines can be a contentious issue. Next slide, please. So the key steps, so it's all about working together, the stakeholder mapping. For each webinar, who do you need to be involved? What information do you need? What's going to be the best time and date to set this? Is it going to be evenings? Is it going to be during lunch hours? When are you going to get the most uptake? And who will your team be? Who do you need available? Who are the most engaging facilitators? And what plans do you need in place to make sure that everything runs to clockwork and the admin before and after works well? And engaging your messages with, on your website, on your Facebook group. It's very difficult to get a very engaging text message within the number of characters that you're allowed. So all of that needs to be planned in advance, and having that really good team that we have with our new care coordinator who's just joined as well. Having that team is really important for planning, and then also for what went well and even better is at the end, and organising your patient feedback. Next slide, please. So we've also looked at our video group clinics over this time as well. So we started off with our very high risk asthmatic patients. So perhaps those have been in hospital, those have had more than 3 doses of prednisolone in the last 6 months, those on shielding. So what is asthma? What is COVID? What do you do if you catch COVID and you have asthma, and what's available locally with things like the hot hub, how to get tested. So any of those, and looking to your partners, to all those that work in your surgery, your reception team, what is the problem that you need to look at? What things are people calling in with? We had a huge amount of mental health, children's mental health, and we had some safeguarding issues. Sadly, we had shaken babies, and we organised a joint clinic with health visitors, mental health, health coach, enormously helpful with social prescribing link workers as well. Each of us did a 5-minute stint, and then it was over to Q&A for everybody else. But having that team, particularly, the health coach was really valuable as well, looking at motivational techniques and lifestyle interventions, and the social prescribing link workers to link what we're doing in the community with what goes on in the surgery. Next slide, please. And we also looked at diabetes, nutrition, and we noted that there was a lot of patients phoning in who were in pain and that had been waiting for orthopaedic appointments, waiting for operations. And we were lucky enough to ask our local pain clinic consultant to come in and do a session with us, which was fantastic. It really gave our patients a lot of advice of what they can do for themselves. And the Q&A for shielded people, we did two sets back in July, and we gave patients the opportunity to really ask us any questions that they probably didn't worrying about at home, something that we could help them with, and we could be available for our patients and make sure that they didn't feel isolated and alone. I think that was really one of the most important things. So thank you very much for listening, and I'll be available for any questions that you may have.